Hi everybody. I wanted to take a second today and talk about how orthodontics relates to sleeping and breathing and our airways that brings all of the oxygen from the outside world into our bodies to feed our tissues and our brain and really helps us on a daily basis. So you may know that we at McGuire Orthodontics and Facial Orthopedics put a very large emphasis on the airway itself and how it relates to your jaws and your teeth and the space that you have for your tongue and breathing as a whole. So at each appointment, before we start treatment, we want to establish what everything looks like underneath the surface. So we use something here called a cone beam CT, which is a three-dimensional X-ray that allows us to look underneath the surface from a three-dimensional standpoint with regards to the size of the airway and how it relates to the teeth and the jaw structures themselves. You may have heard the term growing the airway if you've done some research on your own. That's a bit of a misnomer, as we are unable to really grow anything. Our bodies will have the genetic potential for growth, and what we can do is influence that growth and enhance the size and shape of the jaw structures and the airway itself. So what I wanted to do is show you my airway and things that I may need to do to help influence the size of it, so when I'm breathing and sleeping, I have the most optimal sized airway possible. So when we look at this picture here, this is a photograph of my cone beam CT. And what I wanted to highlight today is this area in red. So if you can see my teeth here, it's as though you're looking at my profile from the side. So underneath the surface, my teeth are here. My tongue fits right here. This is my spine, my brain, and my red colored airway. So when we start from this portion here, which is behind my nose, and we go down this area, we can see some resistance or some thinning in this area right here. And what I wanted to highlight is not so much how I'm going to treat myself, but how this area relates to the lower jaw and the tongue. So a lot of our treatments, whether it's for young children or adults, is to help bring these structures, the lower jaw and the tongue, forward to help open and enlarge this airway that is very important for our breathing. So in our young patients, for instance, we are very capable of modifying the jaw structures themselves and changing the size and the shapes of the bones. That's where the term facial orthopedics comes from. We're able to really change this equilibrium in a better position if the patient needs a larger airway to breathe better. In our adults, it's a bit more challenging, but we're able to utilize the teeth themselves and how they relate to the jaws, and not so much orthopedically change them, but change the position of the teeth for a better bite overall and increase the size and space for your tongue so that we can take the tongue out of the airway restrictions. So at the end of treatment, our goal really is to make sure this tube is as large as possible by modifying the shapes and the positions of the jaws themselves. If you have any questions about this, feel free to reach out. I wanted to just take a minute today and describe a few things that we're doing that's a bit different than just straightening out the teeth. But remember, at the end of the day, we'll get you that beautiful smile that you're looking for, and hopefully an overall better health at the end of your treatment. Thanks very much and have a great day.